Welcome back to the Healthy Commute. I'm Dr. Dan with Dr. Pascal. Well, it's Tuesday afternoon. We're normally be adjusting patients right now, but we are changing things up a little bit, and we wanted to do a little video, a little podcast to basically let our patients know exactly kind of what we're doing and kind of what the next few weeks look like for us.
Absolutely. It should come as no surprise to anybody, obviously, that this is the topic that we're going to be discussing, and that we're following suit with government recommendations.
Right. And this is obviously a very hard decision for us. We've decided to close the office other than for emergency cases until the week of April 6th. And I guess because the first thing, for us, we see ourselves as we're there to help our patients.
Absolutely.
This would be the perfect time that we would want to help our patients, help them heal, function as best as they possibly can, recover, teach them, coach them, help them through this process.
Yep.
And that's the hardest thing, I think, for us is to decide, unfortunately not to do that because of the concerns that we also see.
Absolutely. I think our job, our role, we see ourselves as primary healthcare providers, and our number one job is to help our patients be healthier and be ready to take on different challenges in their health. But in this situation, we also understand the nature of specifically the COVID virus, the COVID-19, being an interaction-based virus. So it's a little bit different, and we're approaching this different than we normally would for, say, either a cold or a flu with patients.
Right. And I think the biggest thing for us is what we do realize, even though we are and have taken, the most amount of measures to keep our office as clean as possible, in terms of us washing our hands, numerous times, between patients, wiping down all the surfaces. We're doing everything we possibly can, but at the same time, we also realize that the number of interactions that are created in our office because of the number of people that we do see, the number of different types of patients that we do see, from the very elderly to obviously young babies and kids and families and everywhere in between.
And those with suppressed immune systems, right?
Right.
What they call the immunosuppressed.
Right.
Yeah. Sorry, not to cut you off.
No.
Yeah.
And obviously all the interactions that can create.
Correct.
And so for that reason that we wanted to just make sure that our patients, our community, are as safe as possible.
Correct. And so, the whole idea that we understand, and the best that we've researched it, because we've both done a lot of reading, a lot of researching, medical journals, listening to public health officials. The goal in Canada right now, the way that we understand it, is what they're saying is curbing the curve. In other words, slowing down the infection rate so that our hospitals aren't overrun with people who need ventilation for those who are critically ill. Mm-hmm. So those immunosuppressed patients, the ones who are in a compromised state of health, if they get the virus, they need help from the hospital. And if too many of those show up at once, creates a backlog, creates a problem. And so our government is saying, let's slow that down so these people, if they do get it, they can get the care that they need. And that number one way that they're saying that we should do that as a community as a whole is to just reduce interactions. And so that's the step that we've decided to get on board with those recommendations, reduce interactions. Having said that, we're still going to be here for our patients in terms of emergent and acute situations.
Right. And maybe just before we maybe talk about that, maybe one way that we were explaining it to our kids, especially my youngest is 10, and they've talked about it at school. They kind of hear us talking about it. And the one way I thought maybe that resonated best with them was, kind of imagining that, let's say, you get to school and there's a rumor about whether you're going to have gym class canceled during the day, and if everyone's at school, that rumor would just create a lot of kind of buzz, and then now everybody would be wondering, and that would create this massive kind of thing. Whereas if there was only 3 kids at school, that rumor of the gym class being canceled would not kind of create such a huge kind of ordeal. So the less interaction, the less, perpetuating that rumor or those interactions, the less that would obviously have the chance to take off.
Absolutely, yeah. So we've decided to do that. So we've decided to close the office to our general patient population, if you will, until Monday, April 6th. So as of Monday, April 6th right now, we're planning to resume full operations, taking care of everybody like we normally would.
Yeah.
But in the interim, we're going to be closed to the average person that's coming in for maintenance care, wellness care, doing corrective care with us. We can resume April 6th, but if people are injured, emergent situations, have a very acute flare-ups in these conditions that cannot wait until April 6th, then you're going to have the opportunity to reach out to us, email us, contact the office, and then we'll make arrangements to come in and take care of you. And so we can still obviously come and adjust you, fewer patient interactions, less volume in the office. It will be, we're going to clean between patients too to make sure that things are up to snuff and clean here too.
Now, the other thing that does create is it creates us the time to do other things to help you.
Which we normally wouldn't have the time to do, right? Yep.
So now we are, considering we're going to do, let's say, Facebook Live videos on, your home traction, home care, stretches, exercises, because, where we were talking about earlier today is, everyone's now either working from home, quarantined from home. We have all this time on our hands, so what better time to recommit to our health, our stretches, exercises, nutrition, sleep, all these things we could do so much better at, because now we have the time to do it.
And I think a lot of patients probably have questions, oftentimes even coming in with their regular visits and knowing that, we'll say the office gets busy, they don't always have all the time that they want potentially to ask us a bunch of different questions, right? And so this could be a great time for you to say, okay, let's schedule a call together for 20 minutes and we'll go through any questions you have about whether it's about back pain, why do I have back pain, what can I expect? Maybe even if you have questions about COVID-19. It's not our area of specialty. We're not, disease specialists, but we do understand it some, and we can help answer questions if people have concerns about that as well.
Yep.
Okay.
So you could definitely reach either one of us, and we could go through things. You could obviously reach the office as well. So info@lindenwoodschiropractic.com. You could reach me at dr.dan@lindenwoodschiropractic.com. Dr. Pascal at lindenwoodschiropractic.com. And then also on our Facebook and Instagram pages and everything there.
So stay tuned on Facebook if you want updates from us. Like Dr. Dan said, we'll be posting as far in advance as we can about Facebook Lives and events that we're doing, but that'll be probably the most active social media platform where we're going to be creating content and some things for our patients here over these next 2 to 3 weeks, while I'm sure a lot of people are going to be at home as well, not just I guess I say it ourselves, but we'll be here doing this stuff, but you guys are going to be at home. So
So hopefully that clears a few things up. Again, questions or concerns, you can reach out to us. But other than that, enjoy your day, stay healthy, stay happy. Everything will be just fine. But until next time, have a great, healthy commute.